In today's episode, we'll delve into the misconceptions about homeopathy. The basic principle of homeopathy is that if a substance triggers a disease, that same substance can be used to heal the disease. This is called the law of similars. In today's episode, we are joined by one of Pune's prominent homeopathic doctors, Dr. Sacheen Khirid. Welcome to the show.
Thank you. Glad to be here.
Yeah, we are excited to have you here. So let's get started,
Yes.
Dr. Khirid. So, Dr. Khirid, my first question to you is that people believe that homeopathy is a slow process.
This is a very good question. And the only way and the answer that I give for this is you have to experience it to understand. Slow and fast is a very relative term. Most people consult homeopaths for very, very chronic diseases. For example, eczemas, which they have not for months, for years.
Right.
Psoriasis, which they have not for months, but for years.
Right.
So everybody has this preconceived notion that homeopathy is very slow. But let me be very, very clear that if a mother brings a child with fever, or if somebody comes with a sore throat or a cold, homeopathy is equally fast. So the term slow and fast is very relative. It depends on the condition, the state in which the disease is at that moment, and that's how we look at it.
Wow.
So slow and fast is a real myth which really needs to be busted. And I'm sure all people who have used homeopathy successfully will agree with what I'm saying.
Correct. So, another myth which people believe in is that homeopathy is placebo.
Yes, this is something we are all being accused of. In fact, so much of the print media, if you keep reading and if you go on Wikipedia, homeopathy is even considered a pseudoscience. They've taken on the page of homeopathy.
Pseudoscience.
Yes, they call it a pseudoscience. Because there's no tangible proof that the medicines work.
Actually work, yeah.
Yes. I have a very, very simple answer to this. And I think if I am able to deliver results in a baby, and it's not just me, homeopaths over generations, because the science is now more than 100 years old, we give our medicines to babies, we give our medicines to pets, some of homeopaths are giving medicines to plants, and you get outstanding results.
My God.
So if it was placebo,
right,
I don't think a baby or a plant or an animal could lie.
Absolutely.
And more than that, even when an adult is suffering, if you relieve somebody of their complaint, it's going to be hard to say that this is placebo.
Absolutely.
So the right medicine delivers result, the wrong medicine delivers no result. That's what I would say.
Absolutely. There's another myth which many of our viewers believe in is that homeopathy is an alternative to surgery.
Okay, so this is a very good point you bring up. You see, our degrees in India, as governed by the Central Council Act of 73, we are called BHM and S, that is Bachelor of Homeopathic Medicine and Surgery. What is this S in our degree? This S is a very important third-year subject.
Oh.
All homeopaths who have undergone a state prescribed syllabus or the National Commission of Homeopathy prescribed, we all study the very same textbook and principles of surgery as do allopaths or modern medicine surgeons.
Oh, is that a fact?
So what an MBBS doctor is studying, we too study.
Okay.
What is the difference here is we do not get into the procedures of surgery.
You do not get into the procedures.
Yes, we are not allowed to go into an operation theatre and operate as per law. Homeopathic medicine is a therapeutic system. So we are to deal with this therapeutic part of it.
Okay.
But the principles of surgery are very intricately woven into study.
Okay.
So we are taught surgery to understand where a case will require medicine and where a case is going to require surgery. Simplest example, appendicitis. If I am a homeopath and I see a case of appendicitis, I have to be in a position to take a call at that moment when that patient is in front of me.
Right.
Okay, I need to refer this patient now to a surgeon, or there's going to be an emergency, or it's something I can handle exclusively with medicines.
Right.
This decision takes acumen and experience.
Absolutely.
And I think that's the importance. So it is not an alternative to surgery. It is in fact complementary, and it is very, very important. Homeopathic medicines help in the healing post-surgeries. Homeopathic medicines can sometimes help avoid unnecessary surgeries. Like maybe a renal calculi.
Okay.
Stones, kidney stones. Very well known. People just know Berberis vulgaris, medicine lay low.
Right.
80% of the times it would work. Even without going to a doctor, you just buy Berberis and work. But a homeopath or the doctor has to know when it can be used and when a case cannot be handled by the medicine. Oh. That is why the surgery part comes. Okay. So it's important to understand this difference.
Whether this case needs a surgery or not.
Yes, whether you require surgery in this or you don't require surgery in this. Like if there's a very big tumor and it's malignant, it would make sense for a homeopath to refer to the surgeon, and the surgeon take out that mass if it is something that's causing an obstruction and a disruption in the patient's life, and then continue treating the patient.
Right.
So a lot of it is to do with common sense, and this is why we are taught principles of surgery in the homeopathic course, and it's a full year studying plus an exam, and we learn everything that they do
Okay.
in terms of practice.
And how long is this homeopathy course? How long
So
does it
it's
take? I
5.5 years, just like the MBBS course. That's
Oh,
the
it's like-
BHMS, and then there is a 3 years postgraduate course, which is called the master's course in homeopathy.
Okay. Okay.
And all this now comes under the government umbrella. So in Maharashtra, we have Maharashtra University of Health Sciences, which
Okay.
governs this.
Oh, I see. So another misconception or a myth is that homeopathy doesn't need diagnosis.
Ah, no, that is very wrong. Because if you cannot diagnose, then what will you treat?
Treat. Absolutely.
Homeopathy is a very symptom based science. So I think that's why this misconception has come. People feel that why do you need to diagnose? You just listen, nah, I've got a headache, it's throbbing, I'm getting blurring of the eyes, I feel like vomiting. You just give me your medicines on this. And
Yes.
most people who do lay homeopathy, rather who are not doctors but who are very good at prescribing, they're able to pick up what is wrong in that patient just from the symptoms, find the right homeopathic medicine, and it's magic. But diagnosis is important so that we don't make mistakes.
Correct. Get to the root cause.
Yes. So, using the headache as an example, if I am not a vigilant doctor, and if a person is constantly getting headaches, and every time I'm giving medicine, he's fine, but it's coming back, it's fine, it's coming back. And if I don't take the trouble of investigating further, and if I don't know whether I'm treating migraine or whether this is a tumor in the brain, this would be a colossal mistake.
Absolutely.
And for any healer, oblique doctor, practitioner, one cannot afford to make mistakes when it comes to diagnosing.
Absolutely.
One shouldn't assume that this is a nothing case. We have to understand it from the principles of medicine, understand what we are treating the patient for,
Absolutely.
and then we can treat.
Absolutely.
So that's why diagnosis is a very integral part of homeopathy. It helps us differentiate what we call common symptoms to find the peculiar symptoms for homeopathy. So it's very, very important for us.
Absolutely. Homeopathy contains steroids. Is this true?
This is a myth that's been going around, and for some reason, all the popular homeopaths are accused of this. Why? This is because the results are fast.
Right.
Somebody comes to you with a very bad cough, you give your 2 pills, you give the next 2 pills, and within the third dose, patient messages you, doctor, I'm great, I'm fantastic. Is this steroid effect? Nothing can be further than the truth. I think this myth has just been generated unnecessarily, and there are some patients who even taken the trouble. I got your medicine checked at a lab and it was positive for steroids. Now there is a big misconception in this, because to check for steroids you actually need to do thin layer chromatography. Most people do a very simple chemical test with phenolphthalein, and it unfortunately gives what we call false positive.
False positive.
But it is not from the homeopathic medicine, because
Right.
homeopathic medicines are made by companies which undergo government regulations.
Right.
It's the sugar goli. You see, the homeopathic medicines are dispensed in sucrose.
Sucrose.
Sucrose gives this false positive, and people then think that there are steroids in this
Steroids
medicine.
in it.
So this could happen even with the chai you drink.
Acha, it could
Put
happen.
your sugar in the tea, that's also going to give you the
That's
same.
right.
So this is something we have to explain to people.
Okay.
Now, if somebody is being unscrupulous and mixing steroids in powders and giving things to people, which we do hear about from some patients, see, that is unethical practice.
Absolutely.
But no sane doctor who is being ethical to his pathy will do something like this to a patient.
Right.
And the other thing very important to remember is, if people blame homeopathy for having steroids, and if steroids could cure everything,
I know.
because then you say that you are giving steroids and that's why patient is okay. Then the allopath has full liberty to prescribe steroid for every single condition, and everything
Absolutely.
should get okay.
Absolutely. Absolutely.
But any known allopath or anybody who's practicing modern medicine knows that steroid has its own big role, and there are diseases where you don't touch them with.
Right.
So this is a very, very big misconception, and it
Right.
really needs to be dispelled with people.
So you can't take medicines, any other medicines with homeopathy.
You ideally can. When you're asking medicines, here again there's a confusion. There is something called supplements, which are our vitamins like B complex, vitamin D, vitamin C. People consider that also as medicine today, but they are actually supplements. And then
Right.
there are actual medicines like antibiotics, anti-inflammatories, anti-epileptics, whatever we use for
Right.
medical profession.
Right.
Now, homeopathy does not have any chemicals.
It doesn't have any
There are
chemicals.
no chemicals in prescribed homeopathic medicines. Everything is beyond Avogadro's number. That is well beyond molecular findings. So you cannot find like natrimur, which we make from common salt. If you test natrimur homeopathically, you will not find the molecule of salt in that. It has crossed Avogadro number by a process called potentization or energization. So homeopathic medicines can safely be given along with allopathy
It can be given.
without any interactions because it will not interfere with the process of the medicine. So if a child has got very very high fever and there is a sore throat and you can see streptococcal infection, in such a case a justified antibiotic would not be a problem.
Wouldn't hamper the.
It would not hamper.
Right.
It would not hamper. So it's very wrong to say that you can't use, if you're doing homeopathy, you can't touch allopathy.
Oh.
It would be a very, very wrong thing to say.
Misconception.
It's absolutely misconception. Some people go over the board. They're taking painkillers for joints for 20 years. And if you as a homeopath tell them, now you first stop everything. I mean, can you imagine the agony of that patient?
Right.
I mean, he's dependent on painkillers for keeping him mobile. And if
Right.
suddenly you withdraw everything, he's going to be more crippled. And
Correct.
then you say, I'm going to give my medicine and then let's see the healing wave.
Mentally also he'll be affected.
Yes,
because,
the patient compliance is going to crash.
Crash, correct.
It is better to let the allopathy run, start the homeopathy, and slowly taper off what is not necessary,
Yeah.
where the body can tolerate better. This is the easier way to do
Absolutely,
it. This is
absolutely.
how I would look at it.
So in homeopathy, there is a thing called potency, and
Yes,
even
yes.
That's between 1 and 99. Or I'm not very sure.
No, potencies, there are 3 scales, what we call. The typical, most common, what we get in our shops is the C potency or the centesimal, where 1 part of an original substance is diluted with 99 parts of dispensing alcohol, and
Okay.
it is succussed, meaning it's given strokes and energy is generated.
Oh,
And then you shift potency. So from 1C, 2C, 3C, 4C, 5C.
okay.
So in the market, you will get 6C, till where you can find Avogadro's number. After that, you get 30C, 200C, 1000, 10,000, 50,000, and 100,000.
My God.
That's the scale that goes up.
Okay. So homeopathic medicines are not for diabetes or diabetic patients.
Of course, they are for diabetic patients. This thing that meetha hai, isliye kha nahi sakte ho is a very wrong thing.
Right.
Because first and all, if you look at it, an average homeopath would give 3 or 4 doses a day. 2 pills maximum, 4 pills maximum, nothing more than that.
Right.
If you weigh all those goalies for the whole day, it's not even going to come to 1.2 or 1.5 gram, maximum 2 grams.
My God.
So 2 grams of chini, which is the tip of your teaspoon ka top.
Right.
So
right.
how is that going to cause any problems? But people have this thing, ye meetha hai, isliye sugar diabetes ko. So
Right.
it is a myth. It is an absolute myth.
Absolute myth. Okay.
Yeah, so we dispense in pills, but there are a lot of homeopaths who also dispense directly the liquid.
That is the liquid. Okay.
But the founder of homeopathy had started the whole process to give it in sugar pills. A, because sugar molecule, when it touches your tongue, it immediately dissolves there and the energy of the medicine is liberated to your nerve endings.
Wow.
So that's how the thing
More
works.
impactful.
Yes, very, very more impactful.
So homeopathy cannot treat acute diseases. Another misconception.
Yes, it is a misconception, and the treatment of acute diseases completely depends on the acumen of the prescriber.
Okay.
In my 24 years of practice, I have treated a lot of acute cases, right from acute bleeding to acute tonsillitis to high grade fevers, and it has always worked beautifully
Okay.
and it gives excellent results. But we have to be confident to be able to find the right medicine because in acute condition, time is of essence. Like we started the interview, I said if a mother brings a child with fever to me and it's 103, I can't tell her ये fever 4 दिन के बाद ठीक होगा, 103 चलने दो.
अच्छा.
By 24 hours, the mother is going to want to see that अभी मेरा बच्चा का सिर्फ 100 आ रहा है डॉक्टर, अभी
Right.
8 घंटे के बाद चढ़ रहा है,
Right.
अभी 12 घंटे के बाद चढ़ रहा है,
Right.
बच्चा खा रहा है.
Right.
So these are parameters we have to be careful of.
Right.
We cannot throw it in the ring and say that no, now you suffer with this.
Right. Of course. Self-medication in homeopathy is possible.
Self-medication with responsibility and education is possible. In fact, I think a lot of homeopathy has spread because people have kits at home and are very well aware about certain medicines. Like arnica is one of our top favorites. You must have
Arnica.
heard this name.
Yes,
Arnica.
arnica. Yes.
So arnica is supposed to be the go-to injury medicine. Like you have
Oh.
a fall, you have a bump. I mean, you can ask so many mothers and parents
Right.
who children have had bumps on their head or they've fallen, and you just
Right.
put 4 pills of arnica And like within half an hour, the swelling starts coming down, the pain goes away, absorption of the hematoma happens.
We used to hear a lot about arnica when we
Yeah.
were young.
So Arnica 30, Arnica 200 is in fact a good SOS medicine to keep at home. Like this, there are around 30 to 40 very good kit medicines, which now certain companies like SBL, etc., sell with the indications. Like there's a very famous medicine called Cantheris for burns.
Okay.
So the first aid for burns is one of the best. It helps alleviate the burning, the inflammation, really works magic.
Okay.
So I think you can self-medicate. You should educate yourself from a doctor or somebody who's knowledgeable as
Right.
to how many doses to take, how much you can repeat, till when you can repeat, till you seek professional help.
Right.
So it is easy to self-medicate. What you should not self-medicate with yourself with is if you're suspecting something like a heart attack or
Right.
you're suspecting there is something that's wrong. That's the time you need to go and see a doctor and make sure that you're not goofing up.
Right. Correct.
So it has to be used responsibly.
Absolutely. A homeopathic doctor can perform surgery. We have already discussed
Yes,
that.
no, they cannot perform surgeries, but in peripheral setups of Maharashtra, especially, a lot of BHMS are practicing and they are very good with minor surgery work. When I use the word minor surgery work, it is more like a very quick first aid and without having to send the patient off to a faraway place for treatment. Like if there's a wound,
Correct.
if you are worked with a surgeon in the past in your internship,
Right.
then if you have learned how to stitch and you have learned how to debride and if you learn how to clean,
Oh, right.
it's perfectly capable by a BHMS. Absolutely.
Immediate response.
But we are talking about surgeries like performing abdominal surgeries. No, those should be handled best by their professions.
by a professional surgeon. Correct. Is it untrue that homeopathy treatment first escalates the symptoms and then reduces and cures it?
A lot of this has come from the literature of homeopathy. And remember, this literature of homeopathy is wide. It comes primarily from Europe, from where it originated, Germany. And it also went to USA for a long time, where Philadelphia became the hub for homeopathy. And a lot of these doctors made these observations. And we have to take the context of time, where they felt that before cure took place, there would be an increase in the symptoms and then suddenly patient got better.
Right.
Now, in our modern day practice, if somebody has got stomach pain, when I am giving medicines like say Magfos, which is a very common medicine for
Magfos.
pain, severe pain, where the patient wants to bend and put hot water bag and feel better. I have never seen anybody say after you give the dose, doctor, pain went up and now it
The
is
pain
come
came
down.
down.
I have not in all my years.
Right.
In some cases where people have, suppressed their symptoms, like especially with eczemas, where they don't even consult skin doctors and they
Right.
put steroids
Right.
and, everything looks clean.
Right.
Sometimes when we give the right homeopathic medicine, it's like an inner healing starts off. Then the body starts throwing all the old symptoms
Okay.
back.
Right.
So then people use this, हाँ देखो homeopathy ने पहले बढ़ाया,
Right.
फिर कम किया.
Right.
So it's like if somebody comes to you with hair loss, imagine you tell them, like, first you will become ganja and फिर बाल उगेगी.
Right.
It doesn't work like that. People have a lot of these myths.
Okay. This pills and then there's a liquid.
Yeah.
So what's the secret? I mean, how
So
does-
the secret is not there.
Right.
Pills are the vehicles. Vehicles meaning they are inert substances. Sugar ki goli hai.
Right.
The liquid is what is made in the pharmacies.
Oh, I
So
see.
the potency is what we spoke about. Na? See, and that's another thing. We have to trust our pharmacies.
Right.
That is why it's very important that the pharmacy that a homeopath buys this medicine from is worthy of
Right.
trust. Because tomorrow you could take a bottle of dispensing alcohol, stick a label and say this is homeopathic dawa.
Right.
Then it will be genuinely placebo effect.
Yeah.
But
Okay.
the ones that come from the companies, they have got batch number, label, index, quantified, everything is tagged, and we have to trust what's in that bottle is typically there, like Nux Vomica 30.
Next one.
There's no way to measure that is Nux Vomica 30 once it's made.
Oh,
We have to trust what's in that label,
right.
and then those drops are put into the pills. So some homeopaths over the years they have found that giving the liquid they find more effective. I think they find it more effective because the alcohol that's there in that, the dispensing alcohol, the medicinal alcohol, it gives you that zing on your tongue.
Right.
So I guess that people have this thing that works better. In my experience, I find pills are equally as fast as liquid, if not superior.
Okay. Is there anything else that you would like to share with our viewers, Doctor?
So people have to remember that homeopaths who have studied a course of homeopathy are actually doctors. People don't even consider us worthy, and in fact, it's sad. Sometimes they even say that "आप तो certificate भी नहीं सर करें." Homeopathic doctors are allowed by Act of Parliament to sign certificates of birth, death, lunacy, fitness, etc. It's sad that society just runs into this mill कि नहीं इनसे तो नहीं ले वो MBBS doctor से ही ले सकते हैं तुम लोग. We learn everything that MBBS doctors do. Our syllabus is same. We learn anatomy, we learn physiology, we learn principles of biochemistry, we learn gynec and obstetrics, we learn forensic medicine. So we do everything that the allopathic school does, the modern MBBS syllabus is. We, in addition to that, study homeopathy as our form of medicine.
Okay.
So it's very important to understand that homeopaths are also very much doctors, and they are not some quacks. And sometimes the word healer is attached to anybody who's compassionate kind. I mean, people come to homeopaths thinking ये तो कुछ टेस्ट में ज़्यादा भेजेंगे नहीं. I have seen many patients who come to you only with a thinking हमको वहाँ पे जाना नहीं, से वहाँ या नहीं कहाँ पे नहीं, वहाँ हॉस्पिटल पे गए तो ये टेस्ट करो, ये मशीन में जाओ, ये खून फलाना निकालो. ऐसे देखो, अगर ज़रूरत पड़ेगी तो करना ही पड़ेगा.
What needs to be done needs to be done.
So people have this thing that ये तो healer है. They kind of give you Baba type figure कि आपको दे देंगे पूरी में हो जाएगा ठीक.
Right.
That is a big myth. And though sometimes it comes across like that, we are literally giving them 4 pills and they're like, अरे अपना पेन तो चला गया. We do have to understand that we have to balance science along with this art.
Dr. Khirid, thank you so much for coming and speaking with
Thank
us on this Wellness Heroes show. And I'm sure our viewers would be enlightened and would now be much more aware of how homeopathy actually treats people.
Yeah.
What are the basics? What are the details? Thank you so much for making our viewers
Thank
aware.
you for giving me this platform, because it helps to reach out to a larger population and hopefully the younger generation.
Right.
Because Gen Z has become very internet dependent and internet badmouths homeopathy very badly.
Oh.
So I'm glad that we can clarify certain things that are out
Absolutely.
there. Thank you so much.
Thank you, doctor. Thank you.